This video is designed to guide nurses through the process for a chemotherapy disconnection visit. We will be discussing the steps for disconnection and the unique equipment used when discontinuing chemotherapy in the home setting. Following this video, the nurse should be able to complete the following objectives: summarize the process for a chemotherapy disconnection visit, assemble the required supplies for chemotherapy disconnection, describe the closed system transfer device system and use, identify the correct procedure for disconnecting chemotherapy in the home, verbalize the contact information at Fairview Home Infusion for troubleshooting needs and questions. We will also introduce the product EquiShield. EquiShield is a closed system transfer device used to protect healthcare workers and patients from accidental exposure to hazardous drugs, such as chemotherapy products. When working with a standard syringe, drugs may leak out into the open end of the barrel, resulting in contamination of the syringe back and plunger. The contaminated plunger and the vapors from the syringe barrel have the potential to contaminate the workspace. EquiShield's design is airtight and provides full protection against vapor leakage and contamination from the plunger and syringe. When using the EquiShield product, it is most important to know that there are male and female connectors, and when the two are combined or snapped together, there is no chance of any drug leakage or vapor release. If you need to draw labs, they should be drawn peripherally or after the device is removed. Labs should not be drawn through the CSTD. Let's take a look at the process. If you are scheduled to disconnect chemotherapy for a patient, your patient most likely has an implanted port in the chest wall or a PICC line. When you have finished your assessment of the patient, gather your supplies for disconnecting the chemotherapy. You will need one chemo disconnect kit, which includes 2 pairs of chemo-rated gloves, chemo-rated gown, absorptive mat, blue needleless cap, 10 milliliter normal saline flush, and female EquiShield swivel adapter. Also gather alcohol wipes, hazardous waste container, and a heparin flush if ordered. Wash your hands and don your PPE. For chemo disconnect, you should be wearing a surgical mask, 2 pairs of chemo-rated gloves, and a chemo-rated gown. The first set of gloves should go under the cuff, and the second set should be over the cuff. Set up your field with your chemo spill mat. Remove any air from the saline syringe. Connect the female EquiShield swivel device to the pre-filled saline flush. Add a few alcohol pads to the field. Place the unwrapped heparin syringe on field if ordered. Remove any tape holding the tubing to the skin and from the clamps. Turn off the CAD pump. To disconnect the chemo line from the patient, squeeze the lever closest to the blue needleless connector and pull apart the male and female connectors, making sure to leave the blue end cap connected to the line. Place the tubing and the chemo bag in the hazardous waste bin. If the patient has a CAD pump, be sure to remove the tubing and place the pump in the yellow chemotherapy transport bag. Scrub the end of the male adapter, which is still attached to the patient's line, with alcohol for 15 seconds. Without contaminating the male end, pick up the saline flush with the female connector and remove the red cap. Line up the red lines on both adapters and press on the female connector and saline syringe. Check for blood return. Remember that you only need to see the blood return in the line. You don't need to pull blood into the syringe. Once you have visualized blood return, you may proceed to flushing the line using a pulsatile flushing action. Pulse pause, to create a turbulence in the line. After flushing the saline, clamp the tubing, then disconnect the entire EquiShield device with the empty syringe attached, from the blue end cap by squeezing the sides of the male connector and twisting. Take care not to remove the blue cap. Place in the hazardous waste container. Using a new alcohol wipe, scrub the blue end cap again for 15 seconds and let it air dry without touching it. Flush the line with heparin if ordered. Clamp the tubing to create negative pressure. Take care not to remove the blue cap. Place in the hazardous waste container. If the therapy is complete, you may de-access the port. If the patient has a PICC, follow the appropriate flushing protocol. Wash hands. Call on-time courier to schedule pickup of the bin and pump if applicable. Indicate that it is a Fairview Metro account and the items will be delivered to Fairview Home Infusion at Kasota. Please call Fairview Home Infusion if you have any questions at 612-672-2233. We have nurses and pharmacists on call and ready to help you 24 hours a day, 7 days a week, 365 days of the year. Thank you for watching this Fairview Home Infusion educational video. We welcome your feedback. Please like this video or leave a comment below.